This question focuses on what is the appropriate treatment, which is also referred to as secondary prophylaxis, for cancer patients who have suffered that first episode of DVT or PE. The reason we call this secondary prophylaxis is, of course, that anticoagulation is not so effective in reducing the clot, but is very effective in preventing extension of the clot and in preventing embolization of the clot, leading to pulmonary embolism. In the past, there was sort of a standard approach that was followed, and certainly this is an approach that is still valid in non-cancer patients. Start the patient on either unfractionated heparin or low molecular weight heparin, transition with an overlap period to warfarin, and then maintain the patient on warfarin with a therapeutic INR of between 2 and 3 for a defined period of time. That could be 3 months or 6 months or a year, depending on the inciting event and the belief or the perception of risk in that patient. That has changed dramatically in the cancer population. This change came about because of a large randomized study conducted by Dr. Agnes Lee and others, looking at cancer patients with that first episode of DVT or PE and randomizing those patients to receive either warfarin with an aim of a therapeutic INR of 2 to 3, which would be standard practice for the non-cancer population, and at that time was the standard practice for the cancer population as well, or randomized to receive 6 months of low molecular weight heparin, dalteparin. This study found that the risk of recurrent VTE was reduced by almost half in cancer patients that were randomized to receive dalteparin. And this led to a sort of dramatic turnaround in treatment recommendations for these cancer patients who have had that first episode of DVT or PE. Other studies have gone on to sort of support this initial study. None of them have been as large as the clot study, but have fundamentally confirmed that using a low molecular weight heparin will reduce rates of recurrent DVT or PE in the cancer population. Additionally, some studies, not all of them, but some studies suggest that these agents may prolong survival in cancer patients as well, particularly the cancer patient with early stage disease. So there's a lot of reasons to use low molecular weight heparins, such as dalteparin, in the initial treatment of DVT or PE. Certainly that is my practice, and it is also recommended both by the American Society of Clinical Oncology, or ASCO, and the NCCN guidelines, both of which are widely followed in the United States.